Thanks.
Okay, so let
And
me
we're live.
let me figure out how to pull up slides from here. Why they disappeared. Also, I cannot see you all right now. That's why Neelam was sharing my slides. So when I am talking about things, I'll have to be bouncing back and forth between it.
Dr.
Um,
Sochka, I can share your slides if you'll just give me 30
oh,
seconds to bring them up.
absolutely. That would be
Okay.
great. Yeah,
Okay.
thank you. That will be very handy so I don't have to I can see you all at the same time. All
Okay.
right. I
Great.
will keep talking while you're pulling those up. So I just want to say, like at the ground level, like as I'm talking about gender affirming care today, right? It's definitely like gender affirming care stuff that we usually think of as gender affirming care, and it's also like welcoming environments and all of that sort of thing. It's everything from the ground to the ceiling and everything in between, right? So I'll kind of, bounce around between those, but it's important to just recognize that gender affirming care is a lot bigger than just offering like hormones and surgeries and all of that jazz. Um, and, for what it's worth, right? Like, I'm not going to go over this stuff today, but I also want to emphasize how important gender affirming care is. You all know this, right? But there is tons and tons and tons of research. And so as we're thinking about, for instance, how this is all politicized, which is something I'll come back to and talk a little bit more about too. We know that gender affirming care matters, and we know it not just because we love people or we there's people we care about in our lives or all of that. Like, absolutely, that matters. But we also know that like there are studies upon studies that show statistics about how important this is to the health and well-being of folks. So we're doing that because of this evidence-based stuff and not just because of our feelings, right? And to be able to frame it in both ways, I think can be really important in this environment. Okay, next slide. So I wanted to spend a little bit of time just talking about education. Clearly, that is like a huge part of what y'all are thinking about and working on right now. I want to name that part of the problem with education is that so much of it's opt-in for a lot of folks, right? We don't have a lot that is being offered across the board. We definitely have that in some areas. There's some pockets where like an organization is like, everyone's going to get this stuff or all of that, but that's not always happening. Of course, there's more and more folks who are coming out of whatever education is bringing them into healthcare with some piece of that. But even then, there's not a lot of standardization across various like roles within a healthcare system of what that education looks like. It's not always mandatory in those spaces, even. So there's a lot of disparities in terms of how prepared people are, even as they're coming out of sort of like initial education. Of course, then in terms of like ongoing training or continuing education, again, very, very obviously a lot of differences, right? Like people can opt into this work and are sometimes excited about that, and some people aren't getting anything, right? Um, so considering that is really important as you're thinking about this. And I think a really big piece, which I'm sure is something you've already been thinking about, is just like, how do we provide this and how do we fund it, right? Like, how do we make sure that people have access to this in a way that puts actual like dollars behind it? Like, how do we make sure that this is really like incentivized, that people are benefiting from getting this information? And so making sure that that's offered is really key. So education, and then that's true for a lot of pieces. It's true for obviously like specific, again, things that are related, hormone surgeries, all of that jazz. And that education is also true for everyone who's working with people, right? That we're offering those sorts of affirming environments. So next slide. Just want to really quickly go across some things about environments. As we're thinking about those spaces, we want to make sure we're thinking about knowledge. And it's, again, not just knowledge that's specific to various things, which that knowledge is really important, but also knowledge in terms of just cultural understanding of trans experiences, what that means, different types of experiences, intersectional experiences, all of that sort of thing is really key in terms of that and needs to be a part of our training. things about language, terms, names, pronouns, obviously, like, well, in my 2 cents, like pronouns are both like the least important and a reflective importance sort of issue, right? Like they're not actually the end all be all, but we know how significantly being affirmed, like in terms of that language of names and pronouns, can be for people. So it matters in terms of kind of creating that welcoming space for everybody. Spaces in general, like we need to be thinking about that in terms of providing welcoming spaces, and we need to be that education really needs to be also helping people think about how that works for all of their systems. For instance, if you have transmasculine people getting hysterectomies as part of their surgeries, are they being placed with like all the folks who are otherwise women? That's definitely something that happens in some of our spaces in Oregon still. Something that can be hard to avoid based on how our systems work, but is really important. All of our administrative systems matter, right? And then we, like supporting staff who have related identities can also be really important. Okay, so when we're thinking about doing this work, my big thing that I like always come back to over and over and over is really thinking about how we need training, we need education, right? But we also need policy that has teeth, like that has something that's going to be able to make sure that any of that education is doing something in terms of providing those spaces. So as you're thinking about preparing like healthcare workers, very broadly speaking, to be able to offer these things, we need to, yes, provide that education. Like I'm a professor, education is great, but we also need to make sure that there's some way to ensure that this stuff is happening. So like it's also part of that incentive. Like people can feel really incentivized because of their own personal care for these issues. And we can also kind of incentivize from the other end, like we need to be doing this in order to be in alliance with things, right? Or in alignment with our goals or organizational policy as well as state policy and all of that. So they need to go together, and we need to make sure that any sort of education and training that's offered is aligned with policy and vice versa. Okay. Let's talk about the next slide. So I wanted to kind of maybe get a show of hands from folks, like how many folks feel familiar with WPATH? Yeah. And how many folks are like, I have no idea. Okay, a couple folks too. All right, great, we got a mix. That I think that's great. So I want to talk a little bit about WPATH, so the World Professional Association for Transgender Health. They have the sort of leading approach for gender affirming care, like standards of care, right? So they're thinking specifically about like trans, non-binary, gender diverse, gender non-conforming, all the language that we use around this population. They're thinking about care that is offered. WPATH is definitely like the leading approach. It's the one that does like a lot of the work with various medical organizations. And by the way, like another thing just to know is that like basically all the leading medical organizations in the US are supportive of gender affirming care. So another thing we can kind of fall back on when we're doing this work, even though it's highly politicized. But WPATH works with a lot of those organizations, is doing work with them to create statements from their organizations about the importance of this. They are, it's definitely an international group of people. Definitely trying to make sure everything is evidence-based. Their standards of care 8 are the newest version, so they've been updated pretty recently still. And that it's like the standards of care for a lot of things, right? So behavioral health, medical health, a lot of things specific to trans care. They talk specifically about youth, and then adults, all of those pieces. And so I think that as you're thinking about your recommendations, like you don't have to read all the standards of care. It's quite a long document, of course. Like if you're not in that area, fine, that's great. But being at least familiar generally with what WPATH is recommending, I think will be really helpful for you and for your group. I love WPATH, and I also will just say that there's kind of an alternative model, which is the informed consent model. Are folks familiar with informed consent model? Yeah, good. Okay. And Maybe some people are not so much. Basically, I mean, informed consent is literally what it is. It just says you get informed consent from folks instead of following all the guidelines and all the procedures and all of that. WPATH, I mean, the standards have become less gatekeeping as we've gone along. That's great. I mean, trying to make sure care is provided, but in evidence-based ways is wonderful. And the informed consent model is basically doing that work of just saying we need to have informed consent to provide various things that are related to specifically like trans-related care, meaning things like surgeries and hormones and all of that jazz. The big thing about the informed consent model is I think it's maybe definitely a lot more contentious for thinking about youth, right? WPATH has some really great standards for thinking about youth care. And we think about even like, who can provide informed consents as like a person in Oregon, we have certain age requirements for that. So definitely, I think WPATH is very important to pay attention to with a lot of youth. But with informed consent, I forgot who was mentioning this earlier, but sometimes we definitely gatekeep some of these exact same things that we don't gatekeep in the same way for people who are not trans, not non-binary, all of that. Things like getting a hysterectomy. There are various like hormonal medications that we give to people all the time if they're cis, and we definitely like prohibit when they're trans, right? So the informed consent model is a different sort of approach. You don't have to go through all the guidelines and make sure all the things are whatever, but you offer that care based on providing information as a provider. The informed consent model, the other than drawback of that model is a lot of times various insurance systems will require like WPATH sort of going along with WPATH to provide those sorts of things. The quality of care you get can be very disparate in informed consent because there definitely are some pieces that are really important to know. There's still research that we're finding out about in terms of health and things like hormones or various surgeries or the combination thereof that are important to monitor as people like are going through their lives and all of that. And so WPATH has some, again, more standardized pieces that the informed consent model doesn't have because it's literally just like, we need to educate patients about this. We need to educate clients about this, and then let them make their own decisions about health. If the provider is not on top of everything, then there might be things that kind of fall through the cracks there. So I'm curious from you, I want to like hear from you for a second to what extent or to like do you think that like understanding standards of care are going to be helpful for your group, like to understand where this sort of care is in terms of your recommendations for things like education, training, hiring, retention, all of that? Are there aspects of it that you feel are like particularly going to be important? Are there aspects where you're like, this is not so important to what we're trying to pull together? I'd love to hear from a couple folks. Anyone want to share?
Hi, Dr. Soika. It's good to share space with you. Just to make sure I have your name pronounced correctly, it's Soika.
Yeah, like the J is a Y sound. It's
Mine
text.
too.
Yeah.
I think one important piece for me in this question is whether we're talking about creating gender-affirming healthcare experiences, whether we're talking about ensuring that there is a sort of cultural appropriateness to the care and an understanding of trans terminology, correct use of pronouns, building up the systems on the one hand in terms of training and education. And another aspect of this is the actual detail of how hormone doses are prescribed. Mm-hmm. Can that be done in primary care settings? And they can. Mm-hmm. What does it take to actually get somebody within a certain insurance system into gender-affirming surgeries? So given that distinction, I do think that for providers who are considering like, hey, I provide primary care, I would like to be able to also manage gender-affirming hormone prescriptions for my patients. Knowing both WPATH and the informed consent model feels very important. Whereas if we're talking about, we want to make, you are a physical therapist, you are a provider who's not interested in, a clinician who's not interested in providing gender-affirming hormones, but wants to create an affirming space, knowing that these exist is important, but wouldn't be, in my opinion, central to a training. So that's how I would relate to these. I would also kind of just add a little bit of nuance here that WPATH is oftentimes criticized for pathologizing trans and non-binary identities and making it that it's inherently something that needs to be medicalized. And that's where the informed consent model is coming from, where it's really trying to depathologize this idea that being trans in and of itself is something that needs to be treated. So I think that is a very kind of important distinction with how these two models are implemented. And even WPATH itself is trying to move a little bit more towards an informed consent model. But in my knowledge and awareness, like a lot of the sort of notable healthcare organizations that focus on queer and trans health, primarily they use WPATH to guide the care, but they oftentimes use an informed consent model to actually deliver that care. Because most trans and non-binary patients want to just be given the information, trust that their doctors know how to prescribe the medication, and then make the decision for themselves.
Yeah, absolutely. I think you said it so well. Thank you. I mean, and yes, I think that WPATH is there's every new edition is working through that pathologization and all of that, and they're responding to things like the DSM and the ICD diagnoses that they don't control, but they're responding to them. And so I think, the new version of the WPATH standards of care, the 8, I think they're trying to straddle some of those things. And yet I know for a lot of people, it's still not far enough. Right. So absolutely. Any other folks want to weigh in on this?
I'll chime in.
Yeah.
The question, is it important? Is this going to be relevant or important, both of these models? I would say absolutely yes. From my perspective, I hear a lot of, like, in your introduction, like the nuance of creating the most holistically supportive space, which is in such stark contrast to other states and what they're dealing with, and the impact, even though it hasn't fallen into the state itself, is a chilling effect across the board, where people feel more reticent to provide this care, which is in part due to a sense of not knowing either how to provide it or what the professional standards and protections are. And this is healthcare, it's regulated and legislated to the nth degree, and part of our ability to do practice in a way that doesn't increase our liability is following these expectations. So in terms of that edict of what's within OHA's ability to do, what is non-legislative, I think the standards of care is a really important component that we, like it or not, it's what we have to utilize. It's the tool at our disposal. And certainly for the work I do, everything we do is in response to these exact models, which are not as well built when you're thinking about young people. Informed consent model with a young person is possible, but it's more complicated, and you need more support, a lot of training. So I think it's always important to say, remember, kids exist too when we're doing this, because they're often a second thought when these things are being developed.
Thank you. Yeah, that's very important. And thank you again. I'm going to come back to the politicization in just a second, but absolutely, it's part of it. And when we think about youth, that is the most politicized area of this, right? So as you're thinking about this, really making sure that is a piece that is going to, you need to make sure it's central to the work you're doing. I think that's very true. All right. Can we keep going? Yeah, chugging along. Okay. Next slide. So in terms of our context here in Oregon, just my couple of pieces that I have to say, I'm thinking about dream recommendations or what you're going to be doing. We really need to think, and you're already saying this, it's already on your brains. All of you were talking about this stuff in the beginning. But thinking about it throughout the state, including our rural areas, our rural areas have very disparate, access to gender-affirming spaces, like healthcare spaces, let alone actually gender-affirming care the specific things that sometimes folks are looking for. And so part of it, I'll just say it's not just that our rural spaces are backwards or anything like that. It's just that rural spaces are literally just more rural. There's fewer people in those areas. There's fewer providers in those areas. People are having to travel greater distances. And so, if you're in Portland, like, yeah, there's going to be a handful of providers that are doing really great stuff and a handful of providers that are really not doing great stuff and everything in between. But in our rural spaces, like, it's just so much more spread out. So it's really hard for folks to get that. Brenna, I see your hand up.
Oh, there we go. Now I'm unmuted. Hi. Yeah, I have a question. I think you're probably getting into the part of your presentation where you're going to talk about recommendations a little bit more. Given my cursory Google of your work, I'm curious if you have anything to say or any suggestions for us to consider around the intersection of trans and queer folks and people living in fat bodies or identifying as fat, and how that mediates access to healthcare. I think that that's something that I know, like, I have lived experience in parts of my life that have touched that, but not something I see OHA pay a lot of attention to in our work. So when I see folks are doing work at that intersection, I'm curious to hear about what that might look like, and or if you've had any thoughts about how that might be something this space could consider as we move forward.
Yeah, oh, it's a really great question. And I wasn't actually going to get into that so much today, but let me share a couple of thoughts on it. We have, sometimes extra gatekeeping for certain populations. Disabled trans folks, absolutely extra gatekeeping, especially depending on, what types of disability or disabilities folks have. A lot more gatekeeping. And the same thing is true for fat folks seeking specific, like, gender affirming care things, right? We will have people not recommend various things or say, we can't access that until you lose weight. This is something that people hear all the time, even when it should be okay, or even when there's not all the evidence to back up what they're saying, or even when it's correlation and not causation, and all of those pieces. So it's absolutely something that is important to keep in mind in terms of barriers that people are experiencing. We see lots of barriers for fat people in terms of surgery in general, right? And so there's a lot of trans folks who are told they can't have surgeries until they lose weight, and we know that weight loss is not statistically, like, successful and on a broad scale. Like, when we do longitudinal stuff, we don't see that. We also know that weight cycling is actually very unhealthy. And so encouraging people to lose weight in order to have surgeries can be a really harmful sort of practice. And, the same thing with a lot of other types of care too. So yes, yeah, definitely. That's something important to keep in mind there. Thank you. Yeah, so gender affirming care throughout the state, definitely making sure our rural spaces are addressed, that people are, again, like, incentivized to get, like, education as much as they can, to find ways that we can always better communicate, like, what providers are offering these spaces. Not just like gender affirming care, but your physical therapist who's, affirming and going to have a great space, and they're not going to dead name people. Having that sort of thing is going to be really important, especially when people are just more spread out, because then communities are also more spread out, and those word of mouth networks that are really important for a lot of folks finding those spaces are just not as effective, because, again, like, it's just fewer people in rural spaces by definition. So we need to make sure we have welcoming areas in all of the areas of the state. We need to make sure that we also are offering care that is specific to gender affirming care stuff. Again, hormones is maybe an easier one. Surgeries are a little harder. But from my work and, like, some of the folks I've talked to in my research, interviews we've done, there are a lot of folks that, traveling to Portland for, like, gender affirming care is cost prohibitive, right? And it's not cost prohibitive because of the actual care. It's like having to go up there and having to, like, find a place to stay, and even getting a ride up there with somebody, and all of those sorts of pieces become, they're just too much of a barrier, right? So we need to make sure we're thinking about those rural spaces and how we can better increase access to care. And then making sure that gender affirming care is relevant to everybody. So in that education, in that sort of those spaces, this is something, again, in my research that has come up, and this is not new, right? It was just definitely something that came up in the research I did with folks in this region here, like this little rural region I live in. But there were folks who were prepared to work with binary trans people who followed that certain narrative of, I was assigned this one at birth and now I'm a man, or I was assigned that at birth and now I'm a woman. And they were not prepared to work with anyone outside of that, right? Like they were not prepared to support non-binary folks, and especially non-binary folks who were seeking things like hormones, because that was experience. Like that is really, really important to make sure that gender affirming care is education around that and spaces around that are not reinforcing certain narratives about like what a trans person is or who deserves this care, even if standards of care don't include that information anymore, right? Like even if our standards are much more open, making sure that providers are aware of that, making sure that our spaces are incorporating that. And then of course, thinking about multiply marginalized experiences. So yes, fat folks, BIPOC, disabled folks, poor and working class folks, definitely thinking about youth and elders, like who are both experiencing sometimes increased barriers to care. All of that is really important in our context, and stuff we need to think about. And also stuff we need to think about in terms of, again, educating healthcare workers, right? Like educating them. We can't just offer a very simplistic narrative because and it's complicated by intersections with other identities, intersections with other marginalized, particularly experiences. Whew, all right. Can we do the next slide? So we only have 3 more slides and then we can just chat after that, all right? So political context, this is my map. It's from the ACLU. I just share this with you. This is the map of things that ACLU has been tracking this year in terms of laws and policies that have been put forth in various state legislatures and stuff that have been, some of them that they've been tracking that have been defeated already, some that are still going forward, all of that sort of thing. But I just share this because it's definitely impacting like our country, this politicization. And even in places like Oregon, where we have pretty good state protections, we have definitely people migrating to Oregon from other places because of OHP, because of like the specific like things we have to support trans folks here in their care and in their medical care. Like that is something that happens. But even in Oregon, we definitely have that sort of resistance that's happening, things that are being introduced. Fortunately for us, we're not like seeing those things get passed like some other states are. But this is a highly politicized space, and healthcare for trans, non-binary, gender diverse youth is a very, very contentious issue, right? You talk to people like random folks about this stuff, and that's their thing. Well, what about kids? What about when they change their mind? What about, you know, like that is a sort of politicization. So that's a space we're in. And again, as you're thinking about preparing a workforce, I guess one of my biggest things is like recognizing that a lot of our workforce in Oregon believe that, right? Even if our main medical organizations are all like gender affirming care is great, we need it. Like, let's keep doing it. Even if all of those things, the reality is that we have a lot of people who are highly resistant to this. And there is, I think, a lot of information that is inaccurate, right? That's being passed around. As a social scientist, I think about, you know, like p-values and stuff like that. I'm not a quantitative researcher, I'm a qualitative researcher, but I like stats. And you think about, you know, if there's a p-value of like 0.05, right? So basically that means that when you're doing studies, 1 out of every 20 studies is going to look like what is not really true, because that's how we publish things, right? So we have a lot of folks utilizing that 1 out of every 20 studies, right, that shows that actually, you know, gender affirming care doesn't reduce rates of depression for trans folks, or, you know, those sorts of things. We have people cherry picking a lot of research right now to try to support their cause. And so they feel informed, all of those sorts of things. And it's not necessarily good information, right? It's not the meta-analyses. It's not, you know, what the bodies of medical care and behavioral health care are saying. So very politicized and, you know, expecting resistance. Of course, there's wonderful folks all over who are like really eager to do this work. But there's resistance. And that's part of why that, you know, like making sure any education goes along with policy or is related back to policy, or there's like a clear connection for workers, that can be really, really important, right? Because then we can kind of, to some extent, sidestep folks who are morally opposed to this because they know that it's still their job, right? They know that this is still something that they have to be doing. And this is not places where there's religious exemptions for our healthcare workers, right? If they are morally opposed and all of that. All right. Next slide, please. Yes, so this comes from specifically from a piece by Juarez et al. I just wanted to share it with you. They are working with folks with medical schools specifically. So this is not like coming from a behavioral health thing, but I found their article, their work was really helpful. They had some recommendations for how to do this work in terms of policy, and it's kind of like the whole gamut of stuff, right? So again, they're thinking specifically about medical school. I'm going to share with you a little bit about what they say and what each of these mean. But I think that we can expand them to think about some broader things too. So first of all, they're saying we need to like really think about how we're assessing learning and creating some sort of standardized instruments, right? So as you're thinking about educating a workforce, like what does it mean to educate? And down here at the bottom, I'll just say, I'm jump to the last one. They say longitudinal research, but on attitudes and competencies, right? And so I think that those are both really important pieces as you're thinking about like, what is even going on right now in Oregon? Like, where are we? Like, how can we work towards moving towards improvement? I think research about what is happening already and all of that will be really important in moving into the future. Again, there's funding that goes into any type of research, but it can be a really important piece. And so that assessing that learning, it's going to be based on competencies, like what people actually know, but also based on their attitudes, like how they're feeling about offering this sort of thing. And both pieces, I think, are going to be really important to pay attention to. They talk about what curriculum is being offered, test modules, all of those sorts of things, right? So really thinking about what is in curriculum or what curriculum you're drawing from. OHSU has some stuff, but they are not prepared to offer, I think, the extent that is needed across the state for all of the providers who might need or want training. There's other organizations that offer various things in terms of education, but thinking about what that curriculum looks like, what is key in that. Always, I love that these folks said this, but thinking about making sure that folks with relevant trans folks are included in this, and especially like trans professional folks with relevant backgrounds, like everybody who is yes, a part of healthcare systems, but also part of other sorts of systems like trans researchers and trans legal experts, and all of that sort of stuff, making sure that people are at the table in doing this work. And I think that's a pretty easy recommendation for you all to think about. Is just making sure that lots of folks are they're drawn into this conversation and making sure to give feedback. And I'm assuming that's already on your brains too. Monitoring health outcomes of folks. Again, research, that's really hard, but really thinking about like how well is this working? So it's not just surveying or getting information from folks who are staff who are providing, but also thinking about how people are receiving that care and what the health outcomes are. Encouraging gender-affirming care experienced people to mentor other folks is another really great one. So I'll talk on the next slide a little bit about this too, but that is one of the biggest ways that people get training or education around this. It's not even going to a training or any of that. It's that sort of one-on-one mentorship for someone who's experienced in this area. So making sure that is happening and supported, those sort of mentorship relationships is really key. Emphasizing privacy, confidentiality, and cultural humility in terms of work with this population. Obviously, creating welcoming environments, very key. Providing funding for model programs. And so I thought this was really interesting and something that a lot of folks have been talking about. If you're thinking about what is going on in Oregon, really thinking about model programs that might be in different spaces in Oregon, and or meeting different like specific populations. Those can be really helpful as you're thinking about making sure that various places are prepared, and then drawing from their success and learning from those challenges that folks are having as well. But especially thinking about, like, again, across our state, rural areas and multiply marginalized populations. And then again, longitudinal research. So as we need to think about how we are tracking what's happening, right? How successful is it? What's going on? Where are people with everything? Okay, and then next slide. So as you're thinking about the work you're doing, right, I wanted to share in terms of training and education piece. This was a piece from a bunch of folks, Stryker, Polerla, and Pickle. This was not Susan Stryker, who's also a big name in trans studies. This was a different person. But they were talking about gender affirming education. And they had specifically researched like why are like medical providers and other providers like seeking this stuff out. They said the biggest sort of motivation was filling a need and then working with a specific person, right? Like this is why people sought out more information, was they were like, okay, I realize that no one's doing this work, so somebody's got to do this work. And or they're like, I have this person I that is already my patient or client, and I don't know what to do, or I don't feel prepared. And then they seek out the education from there. Those were like the biggest motivators for why people wanted to get training, right? And so I just was like, we should be aware of that as you're thinking about your recommendations. Like that's what folks are coming for. And then they also were like looking at where people are getting that education. The biggest area was self-study, right? They're looking at things like guidelines, like standards of care, all of that. They're looking at the relevant literature in their field or what have you. And so, you know, they're just doing it themselves sometimes. And then the other two pieces were professional conferences, you know, like getting the education from someone who's providing like lectures and all of that. And or, oh, I'm sorry, it says membership. It should say mentorship. I wrote that wrong. And mentorship is the other really big one, right? So that is where people are getting a lot of this. And I also think it's just maybe important to keep in mind as you're thinking about training, as you're thinking about this education piece, like it's not just like a training, right? It's these mentorship roles. It's helping people be prepared to do their own research, to do their own like information gathering, making sure they're aware of things in whatever area that they might be in terms of care. Because there's literature in all sorts of areas, from, you know, community health workers to dentists to whoever, like lots of folks are talking about these issues. So making sure that they also can find that information easily can be something that could be done by, you know, various by an organization, right? Like pulling together some of that and being like, here's some good places to start. And then just thinking about the rest of it, right? I would say that the last thing I want to just touch on is like, how are people supported in doing this work? Again, if we're thinking about the fact that there are some people with some very deep resistance to gender affirming care, and if they're in small organizations or they're in more rural areas where there aren't as many people, again, that can feel really isolating. It can feel really lonely. Healthcare systems providers that are doing this work are experiencing stigma and all of that, right? And so I think we need to be thinking about how to support them, how to support folks in doing this work. So yes, support them in terms of, sorry, give me a second. Yes, support folks in terms of like specific, you know, again, the things we tend to think about as traditional gender affirming care, but supporting them, everybody, in providing these welcoming environments, right? So like how do you do that, especially if they are going to have resistance not only from other like healthcare systems and people and all of that, but they're going to have resistance from their communities. Sometimes they're going to have very vocal resistance all over the state. I think that can definitely happen. So what does that support look like to make sure that people are feeling like this is worth their energy and their time, and this is worth the sort of backlash that they might be receiving for it. This is worth the challenges that they're going to have. So that support, I think, yeah, is really critical. And then, yeah, my last slide, let's talk. I'd love to hear folks' thoughts and hear what you're all thinking about all of this. And I'm happy to answer questions if there's something I know, and maybe folks can answer each other's questions if it's things I don't know too. So yeah.
Thank you so much, Dr. Soika. We just really appreciate that. What a beautiful presentation. Thank you so much. Okay, folks, let's chat about it. What questions do you have?
How do we do all that?
Yeah, how do we get there? Thanks for saying it first, Danielle.
I appreciate it. I really appreciate that the Juarez article. I'm looking at it, and I'm just sponging off your brilliance, Dr. Soika. Thank you. And it's fun for me to call you that. And so I'm just thinking about, the mentorship piece, that has been really important. And I'm working that, and I'm working, not every to call themselves a mentor, right? And so building that confidence in people is what I've been working on. I too have education background, and I'm not healthcare. And so like they ask me for, health outcomes, and I'm like, well, I would think anxiety and depression decreases, right? Like that's what we're going to look for in different co-occurring things. So I'm just, I'm sort of, I'm glad to know what you said, because I think we're on the right track at La Clinica. What I'm noticing is I've started the mentorship group with 8 providers who are already doing this work. And so I'm working with them. And then when I go out and I get an email from a provider who is asking me questions, I'm like, oh, this is a person who's generally interested and wants to know. And they want to fight. And so I'm learning about, I'm just learning about some of those little just tells that are telling me, like, you're not wanting to do this care. And so I this is more just like all the things that kind of came up for me while I'm listening to your presentation, and I'm wondering if folks have similar experience out there. And I really want to say thank you, because you always share with me these amazing resources and questions that get me even more motivated. Yeah. So thanks for the airspace.
Great. Thanks for that, Danielle.
Thank you. And I'll just say, maybe mentorship is the wrong word, because people feel like they have to be an expert first, right? Yeah. If we shift that, that's the problem. If people aren't even getting this education, or it's not standardized, or there's no whatever, but this is something that when we're thinking of providers, right, who are doing specific things, they should be offering this stuff, right? It shouldn't be a separate area or that. But maybe it's not mentorship, I'm an expert to be able to teach these other folks. Maybe it's we can come together, and maybe I know some things and I'll help you with the things I know, and we can grow this relationship.
It's learning partners or something.
Yes. Yeah.
We're in this together, and we're totally.
So I think a lot of people feel really resistant to calling themselves an expert in this area. And I think it's because, for a lot of reasons.
I'm really kind of glad about that, actually.
Yeah.
There's some humility.
Yeah, right.
So Danielle, to build off of your statement, could you see hubs peer knowledge sharing hubs across the state, made up of people, the whole gamish, right? Front office folks, billing folks, providers. We're not just talking about providers, because gender-affirming care is everybody in the clinic. Dr. Abby Mulcahy told us in a very impactful presentation that she made to the smaller group is that every encounter is an opportunity for gender-affirming care. And I want to have that tattooed somewhere. I feel that strongly about that. So that is one concept, but let's hang on to that, okay? thinking about what learning hubs would look like, staffed by peers, right? What's everybody else think?
I think I want to go back to the sort of important point, Dr. Soka, that you brought up, that you need policies with teeth, right? Or you can't just rely on the folks who are bought in, who really care. You know, kind of talk about audience segmentation when I do trainings on this. It's like and these are like approximates, but it's like there's the 10-20% who really care, who just want to like do best by their patients, you know, are really invested, know people who are trans or non-binary, themselves. Then you have like this 30% who are like, I'm open to it. Like, I want to be a good doctor. I don't particularly have a strong affinity to this, but like, I care about doing good work, right? Then you have like another 30%, 20 to 30% who are like, I'm going to do it because you're making me do it. And I don't really care. Whatever, fine. It's the compliance group. And then you have this like chunk who's like, no, stop it. What you're doing, I will not do it. Right. And you kind of have to think differently about how you reach all those groups, right? And where you leverage policy and compliance. And, you know, you connect it to payments, you know, you connect it to quality care indicators versus, oh, you just make it available, right? And you create space for folks to participate. So I think that's sort of a really key piece as we think about recommendations, is we're making sure that we're coming up with things that actually span the gamut, because also if we're only kind of making things available to folks who are already bought in, or who are sort of already are kind of, we're singing to the choir, right? They're still going to be geographically located in particular areas. There's still going to be huge gaps that result because we're ignoring that piece of like, okay, great. So it's education, but is it voluntary? No, it's mandatory. It's part of your education. We require like, in order to get licensed in Oregon, you have to take this damn course, you know, and you need to have continuing education on it. And you have to prove that you listened and learned. And we have some measures to show that you actually did it. So yes, those are like some of the reactions I had. And thank you again so much for your presentation.
Yeah, thanks, Julia.
Absolutely. Those different populations. Like when I'm working with an organization, I'm always asking people ahead of time, like, where do people fall? Like, how many people are like in that really, really resistant category? How many of the people are like, I'll do it, but I'm not happy about it? You know, like I'm asking folks about that so I can kind of provide something that meets the needs of the organization, because it's really important, and you have a different approach, right? When like the folks who are already really excited about it, awesome. You don't need to convince them at all, right? You know, and everyone else, like there's some level of convincing, and from my perspective, I don't think the level of convincing is on the level of morality. Like it's not on the level of this is the right thing to do. I think that level of convincing is this is the thing you have to do, right?
Mm-hmm.
And that at least provides like some sort of basis. It lifts the system up to a certain amount, and then you can have those other people take it on, right? And the folks who are really excited about it can really lead the way.
Absolutely, that sort of compliance. And then also like when I've worked with providers, it's always been like the folks who really care about being good at their job, right? And it's almost like, okay, well, this is part of now where the standards of care are going. This is part of me being a good, like that. I always think that's an interesting group to appeal to as well. And they also need a slightly different approach.
Great, thanks so much. Katrina, do you want to talk about the survey that you've dropped in the chat for us as a reminder?
Sure, I'm happy to.
Thanks, friend.
It's along these lines of what we're talking about. We are hoping to get all of y'all's opinion, as well as other partners that aren't in this space today, about some. We recognize it's really hard to stare at a blank sheet and come up with ideas sometimes. And that's why we're having these discussions and why we're trying to start somewhere. And so the survey is some long and short-term policy suggestions that might feel important and intriguing to people, and also they might not. So there's definitely another option, and you can free type if there's things that you feel would actually move this work forward more significantly or more impactfully. But we're starting somewhere with some ideas and just trying to get some group consensus. So the survey is really asking who you are, where you're coming from as far as organizationally in your role, and then your top 5 short-term and long-term policy suggestions that we can then use to have these recommendations presented by the end of the year.
Great. Thank you so much. And when would you like to have the survey completed by 5 p.m. on the 8th? Okay, great. I had to roll down. I thought 5 o'clock. Uh-oh, I already missed that one. So no, it's not till the 8th, folks. So, right, Yulia, I love me a survey. Me too. Thanks so much, Katrina. Okay, so yeah, we are going to get some feedback from you on that survey, which is great. What else would you like to talk about from this presentation? What stood out for you? I know I dropped a whole, go ahead, Yulia, go for it. I'm watching your face, friend.
I was like, no, I don't want it. Something will go. But I just also wanted to really highlight and kind of echo what you shared about engaging trans and non-binary folks from across professions, including trans and non-binary patients, as key. And I think that's going to have to be just right off the bat. One of our recommendations is like, hey, going forward, one of our strong recommendations is that you assemble a community group that's compensated for their time and expertise of trans and non-binary patients and providers to take a lead on this.
Yes.
With the support of policymakers and like healthcare system folks and all that other stuff. But that's, I think, going to be for us I would really hope that that's where we go as a group.
And I would say, you know, in rural communities too, I'm starting to organically form, you know, people who are doing the job I'm doing at different organizations, and we're starting to come together a little bit and have informal meetings. That's been really beneficial too. So we need some more coalitions like that. Just in that alone, just in the casual meetings I've had alone have been really beneficial to how I'm thinking and how we're moving things forward at La Clinica. So yeah, thanks for that, Yulia. I appreciate that. Yeah.
Yeah, absolutely. Bring your friends.
Good people doing good work. Yeah.
Mm-hmm. Okay. I want to be mindful of time. So I don't know, Deepti or Neelam, you're back online. We missed you.
Yes, I'm glad that was just a momentary outage, and I apologize for any disruption it caused. And thank you so much, Meg and Katrina, for picking up and just carrying along so seamlessly.
Happy to.
Yeah, just wanted to also let you all know that you know, we will send around the survey via email, as well as Deepti mentioned, a doodle poll, so we can get the remaining 3 meetings on your calendars.
Great. Righty. And I'm just going through again the deck from earlier just to make sure we covered everything. I think we did. Okay. Fantastic. Well, Neelam, as the host, I'll let you wrap this up then, my friend.
Yeah. Well, just wanted to, you know, again, gosh, I'm keep mispronouncing your name, Dr. Soika.
Soika.
Yeah. Thank you so much for joining us today. I realized also you had a full day of teaching. I wouldn't have been able to tell at all unless I had known, and just appreciate you so much. And thank you to everyone, the work group members and the OHA staff, for just such a wonderful meeting and conversation. And we look forward to seeing you next month. And we'll be in touch in the meantime.
Yeah, super. Thanks so much.